There you go. And I'm going to share my screen to start the presentation. There you go. It's all yours, Marcy.
Well, thank you so much, Sandra. As I said, I am the Director of New York City Outreach for the New York State of Health, and welcome to the Montefiore Community 2021 Open Enrollment Information Session. Next slide. What is the New York State of Health and who uses it? Next slide. New York's official health plan marketplace. One-stop shopping for subsidized and unsubsidized coverage. Easily compare health plans and options. Free personalized enrollment help. The only place to check eligibility and apply for financial assistance. Enroll in qualified health plans, the Essential Plan, Child Health Plus, and Medicaid. This is available to New York State residents who are lawfully present. Next slide. Enrollment Fast Facts. More than 4.9 million New Yorkers have enrolled in health coverage through the marketplace as of February 7th, 2020. That's more than 1 in 4 New Yorkers. Since the marketplace opened in 2013, the number of uninsured New Yorkers has declined by nearly 1 million. Next slide. What benefits are included in the New York State of Health plans, and is financial help available? Next slide. Covered benefits: free preventive care, inpatient care, outpatient services, maternity and newborn care, emergency services, lab imaging, prescription drug, rehabilitative and habilitative services, mental health and substance abuse disorder services, wellness and chronic disease management, pediatric dental and vision. Adult dental coverage and other benefits may also be available. Next slide. The Essential Plan. This is a plan for lower income New Yorkers. Under New York state law, Essential Plan coverage costs either $20 a month, less than $1 a day, or nothing. Free preventive care, no annual deductible, low co-payments such as $15 for a PCP, $25 for a specialist, $6 generic drugs. This is for the highest income Essential Plan enrollee. All plan coverage have the same benefits. Vision and dental coverage is available at an additional premium. Next slide. Eligibility for financial help. Household size of 1. Medicaid at 0 premium is $17,609. This is the maximum annual household income. Essential Plan at 0 monthly premium, $19,140. This is the maximum annual household income. This is not eligible for Medicaid, Child Health Plus, or minimum essential coverage. Essential Plan at $20 a month, $25,520 is the maximum annual household income. Qualified health plans with tax credits, $51,040 is the maximum annual household income. Next slide. Here's an example of a household of 4. Medicaid at 0 premium is $36,156, maximum annual household income. Essential Plan at 0 monthly premium is $39,300. Again, maximum annual household income, not eligible for Medicaid, Child Health Plus, or minimum essential coverage. Essential Plan at $20 premium is $52,400. Qualified health plans with tax credits is $104,800. That is the maximum annual household income. Next slide. So to view plans and estimate your financial help, at the home screen on the website, newyorkstateofhealth.ny.gov, click Get Started. Next slide. You can estimate what your financial help will be by entering your county and/or borough, the pertinent information listed here, and clicking Calculate. Next slide. When and how can I enroll into the New York State Health Plan? Next slide. Medicaid, Child Health Plus, and Essential Plan. Enrollment is open year-round. Qualified health plans enrollment is during an annual open enrollment period, currently going on November through January 31st, or through a special enrollment period with qualified life event, including loss of health insurance for reasons other than you did not pay your premium. Next slide. Here to help during the COVID-19 pandemic, New York State of Health has a program. If you have lost your job and health coverage, apply through the marketplace within 60 days of losing your employer-based health coverage. Next slide. New York State of Health is currently open for enrollment through the end of 2020 because of hardships faced by New Yorkers due to the coronavirus. Next slide. How to enroll. Enrollment assisters. Located in every county, you can make an appointment for free personalized application assistance. We have assistance in 38 languages. If you look up the website at info.newyorkstateofhealth.ny.gov/find an assister, you can scroll through and find what you need. Customer Service Center at 855-355-5777. You can get your questions answered. You can complete an application over the phone. Customer service is open Monday through Friday, 8 a.m. to 8 p.m., and Saturday, 9 a.m. to 1 p.m. There's assistance available in all languages. You can also enroll yourself on the website. Next slide. 79.9% enrollees get help from an enrollment assister. Next slide. How can I learn more about this New York State of Health? Next slide. View the resources online. On the website front page, click resources. You can find educational videos, educational materials such as rack cards, fact sheets, and at-a-glance cards. Next slide. Materials are available in 27 languages. All materials are available in 9 core languages, which are English, Bengali, Chinese Simplified, Chinese Traditional, French, Haitian Creole, Korean, Russian, and Spanish. We also have materials available in 18 other languages listed here. Next slide. View resources online. New York State Provider and Health Plan Lookup Tool is a great tool that you can use when you are deciding which health plan to enroll in or when you're looking for a provider, a hospital, or a doctor that works for your plan. Next slide. To contact a free enrollment assister for help, go on the home page at newyorkstateofhealth.ny.gov. At the top of the state homepage, look for Get Help. This can be found above the orange ticker link on the coronavirus. In the drop-down, click Navigator Site Locations, then click on the statewide enrollment directory. Next slide. This is what the page will look like. Scroll through and find one in your area that works for you. Next slide. You can follow us on social media on Facebook, Twitter, YouTube, Instagram, LinkedIn, and Pinterest. Next slide. Now we are available to take questions. You can drop them in the chat, or Sandra can unmute you and you can ask me directly. This is Liliana's information. She is the Senior Director of Health Operations for the Hispanic Federation, one of our assisters who I know is running late, but should be on shortly to help us answer questions. And this is how you reach her directly. You can also, again, go to the website to find an assister or give us a call. So who's got questions? You can drop them in the chat.
Okay, well, we get some questions from our participants, and hopefully we get a lot of them. I have a few questions too. Like, how does this work, or it doesn't work at all for undocumented people?
Well, it all depends on the situation with undocumented individuals, right? We have emergency Medicaid, which the assisters can get people in if they have a medical emergency. And depending on what type of documentation they do have something or other, they can work with them. The best bet is to either give Liliana a call. I would leave her slide up, Sandra, so people can grab it. Give Liliana a call. She can work directly with you from the Hispanic Federation, or go through one of our sisters. They can work miracles. How does emergency Medicaid work? If you have an emergency, you are here and you are not documented, and you come down with the flu and you have to go to the hospital, they can enroll you right then and there for emergency Medicaid, because you have an emergency and you need coverage. If you have a chronic condition such as diabetes, and you're here and you don't have coverage and you don't have ID, you can get enrolled in emergency Medicaid, which is why you guys want to reach out to one of the assisters if you know somebody or you yourself are in that situation. They can work miracles. Sandra, you said you had another question?
Yes. What about mental health? When you were going over what services were covered, I'm not sure if I saw any behavioral health or mental health coverage.
Oh yes, mental health is covered. 100%.
Okay.
Yes, yes. That law was passed before the ACA came into effect in New York State. So all plans have to cover mental health, whether it's Medicaid, Essential Plan, Child Health Plus, Qualified Health Plans. All of them have to cover mental health. Now, there was a question that came up about COVID-19. A lot of people are losing their jobs. What happens if they didn't apply within 60 days after losing their job? Hi, Liliana. Can we give Liliana the ability to speak? She's on.
Hi,
Thanks,
Marty.
Sandra.
How are you?
Good, sweetie. We can't see you.
Yeah, I don't know what happened.
Click your screen and click the little video thing.
I don't have an option of video. It looks like they didn't give me that option.
No, you do. Anywho, we'll just figure it out, and we'll go to the question, which is because of COVID-19, a lot of people are losing their jobs. What happens if they don't apply within 60 days of losing their job? Now, correct me if I'm wrong, Liliana, but during this special election open enrollment period, you can enroll anytime.
Yeah.
Go ahead, Lil.
Yes, currently, right now, the governor has extended this special enrollment period until the end of December. So individuals that are coming in and are applying for coverage on a normal year, anything after November 16th would be for coverage January 1st. But right now, individuals that are applying right now in December can have coverage December 1st or January 1st because of COVID-19 regulations.
Correct. Okay. So, Lil, another question. Emergency Medicaid covering coronavirus testing in urgent care and hospitals.
Well, COVID testing is free. So, you know, anyone can go into any of the testing sites and get tested at no cost.
Correct. So not your private doctor. If you went to your private doctor, you're going to get a bill or you're going to have to pay. But if you go on the governor's website or even our website and click the coronavirus link, you can find free tests across the state, down the block. There are several. everywhere. So you don't have to present a medical card. They just need to see some sort of ID that tells you where they can send the test results to, and a phone number to reach you. It's really very simple. Is it possible to leave your tablet in one? Oh, I'm so sorry. Thank you, Sandra. It's resting on my knee.
Okay,
So,
Mhm.
go ahead.
No, I was just gonna say if we have any other questions from our attendees.
Is everybody clear on the financials? So Sandra, if you can bring up the slide with household of one, I can just talk that through a little bit more so people are clear.
Yeah, it would be good to know like how this exactly works. I mean, I've seen this before and I'm still not sure. So let's say that I'm coming to you, right? And
Bring up slide
I
8,
need,
sweetie, so they can see.
oh, I'm sorry. I'm just looking at it and I didn't share it. Okay, so let me see here. There you go. Can you see it now?
Yes,
Yes.
but I see a lot of stuff up. There we go. Okay. So go ahead, ask your question.
So yeah, so let's say, you know, I'm in need of insurance. I have some income, right? I'm employed, but I don't get insurance by my employer, and obviously I cannot pay a private insurance. So I'm coming to you, and what are the next steps? Like, how are you gonna help me?
Lil, do you want to take her through the process?
Okay, so
Yes.
I mean, the first step is individuals call us. Because of COVID, the state has been very flexible and we are doing most of our work remotely over the phone with individuals. You come in, we open up an application for you, which is an online application through the New York State of Health Marketplace website. And we ask the basic information of your household. You'll need to have ready information for yourself. If you're a single individual, it's just yourself. The screen that is up here is talking about a household of one, a single individual. If it's a couple, you will need the information from both. Also your income information, we'll need your email, we'll need, the social security number, address, all of that will be put into the system. You'll need to be identified, and the system will take the person, through an ID proofing process that they do kind of backstage. Then we start inputting the information of everyone in the household. We put in the income of everyone in the household. If there are any deductibles in the household, when you add that into your taxes, you are able to put in some of those items into the application. If someone in the household has a chronic condition, that's also put in there. If one of the family members is unemployed, we put in that information. Someone's receiving other type of benefits, also that is put in there. At the end of that application, right now, the system's going to be asking more of the 2021 household income information, rather than 2020 information. So the questions are phrased a little bit different because we're already at the end of the year, and most of individuals coming right now are coming to be activated as a January coverage. And then at the end, once we input all the information, the actual application, the online application, generates what this household is eligible for based on household size and household income. So those are the key items that determine what program the family will be eligible for. Obviously, then there's other factors such as immigration status and categories, right? Some people are eligible just for essential plan. Other people are eligible for Medicaid. And then if your income is above a threshold, then you are only eligible for qualified health plans with tax credits. And then we have individuals that are not eligible for any tax credits, and you need to just decide on what options you want in terms of if you want a bronze plan that is less expensive but higher deductibles, or if you want a platinum plan, which is their monthly premiums are higher, but you pay less out of pocket. So it all depends on household size and household income.
A couple of things that we should point out. When we talk about household annual, maximum household annual income, right? You're looking at, for an individual, $17,609. If you make $17,610, you're going to go into an essential plan. If you make $19,141, you're going to go into an essential plan at a $20 premium. So it all depends on what your income is, and it's based on your taxes. Another thing that people should be aware of, when you are looking at a plan and you're trying to figure out what's going to work for you, with the bronze and the silver plans, there are now 6 free visits. And what I mean by that is you have 3 wellness visits and you have 3 sick visits. And your copays do apply, but it does not go towards your deductible. You don't have to pay full balance out of pocket to meet your deductible. So you have 6 visits, 3 well, 3 sick, until you start having to pay down your deductible in this bronze and silver plan. So that's an important feature that everybody should know about as well. Do we have any questions?
One thing people should be mindful is, this information gets updated on an annual basis, right? So your incomes every year will be different. So you might have fallen into a printed at a glance card that was a couple of years back. We have to be careful with that because incomes every year will be slightly different in each category.
Liliana, we have a question here. Immigrants without legal documents are able to apply through the New York State of Health. And what happened when adults are having tourist visas and they need to see a doctor?
Okay, those individuals that have no status in the country or in the state are able to apply for something called emergency Medicaid. That's something that New York has. Not all the other states have. Only one other state has that, including New York. And that emergency Medicaid is only activated at the moment this person has that emergency. That emergency could be, they fell, they went into the ER and they need to get a procedure or surgery or so forth. Or they have a chronic condition that they need this medication that they cannot be out without it. And the state will evaluate the applicant, and usually they get activated for a year, but then they have to come back and reapply and get reevaluated again for that emergency Medicaid program. There are some visa holders that are eligible for coverage through the marketplace. I would recommend having those individuals sit with a sister navigator to go through the application process, complete the application. Keep in mind, there is no commitment until you decide at the end of the application which program you want to sign up for. So you can start off an application and then decide what is best for you. The system has it generates automatically what program you're eligible based on, what visa you have and so forth. So my best advice to individuals is come in, join any of the assisters in your area. Feel free to call us at the Hispanic Federation and we would be able to help you. We have a couple of subcontractors throughout the New York City area that have assisters at their sites also that can help you. Most of the work is being done remotely. There are some sites that have a few days of the week at sites, but because of COVID-19, I recommend that that it's best you do it over the phone.
Great, thank you.
One vital thing, and I know it's important, and people don't feel comfortable at times, you know, to share information. Keep in mind, the sisters are certified by the New York State of Health. They are held accountable by all the HIPAA regulations. Also, they signed off on all of that once they are trained by the New York State of Health.
Perfect, thank you, Liliana. Sandra, maybe we can bring up the screen with Liliana's contact information again.
Yeah, I also put it in the chat box for everybody.
Oh,
They can get it.
terrific. Okay, terrific.
Here is a question. Okay, so you go online, you're determined eligible for this. What are the next steps after that? It sounds like you're talking about different plans like silver, bronze, you know, stuff like that. I know that when that happens, a lot of people start getting confused. Like, what's the best plan for each type of patient or person? Like, you know, I feel that once you get to that point, you never know what to choose. Like, what will be the best, or is it dependable on
Right.
the family or the individual? Like,
This is why I recommend working with an assister. One good thing is when you work with an assister and you find out what you're eligible for, then you've got to figure out what plans. And in each level, whether it's Medicaid, Essential Plan, Child Health Plus, or the metal plans, there are several options to choose from. A lot of people have their regular doctors that they like to keep, their PCP doctor or their specialist or both. And when we talked about that provider lookup tool, that is one of the best tools. You put in your provider, and under your provider, you can see which plans they accept. And I've done this with people, Liliana's done it with people, and we make a list out of which plans the doctors accept. And we take out plans that the doctors that they want to keep aren't in. And I have yet to find a plan that not all the doctors take. Not yet, anyway. So you look that up, and then you say, okay, my PCP is in A, B, and C. My specialist is in A and C. My OBGYN is in A and B. Well, A seems to be the one that everybody's in. So let me go with plan A because everybody's in it. I already know I'm qualified for the essential plan. So everybody's in plan A under the essential plan. Let's go with that. You know, if it's the bronze plan, everybody's in this bronze plan with this provider. Perfect. I also like the benefits and blah, blah. Perfect. You know, you have to compare apples to apples, and you also have to take your time. It's important that you take your time because you only have 30 days to switch, and then you're locked in for a year until the next open enrollment period. So we want to make sure that you are clear on what you're doing and that you're happy with what you're doing and that your doctors are in. New York State of Health lookup tool is the most updated lookup tool. It's more updated than some of the insurance plans websites. So it's a really good tool. If you also want to know what hospitals the doctors are in, that's listed as well. So there's lots of good ways and good tools that can help you figure out what plan works best for you. And the finances are important as well. It doesn't make any sense to purchase a plan that's going to put you in financial peril when there's something available that won't. So Liliana, do you have anything you want to add?
Well, just to make clear to everyone, and many times we get these type of questions, right? People come, they mention a plan name, right? Remember, keep in mind, these are the programs. Medicaid is a program, Child Health Plus is a program, Qualified Health Plans is a program, and the Essential Plan is a program. And within those programs, if you at the end of your application are eligible for Medicaid, you might have 10 different plans that are offering you Medicaid in your neighborhoods where you live. So you have to have that clear. And people get confused a lot of times. He said, no, I don't want Medicaid because I have this plan. And, you know, and I don't want to mention any plans in this call because we want to keep everything neutral, you know.
Right.
We are in a sister agency, and we are not here to push any plans at all. And I want you all to keep that in mind. But plans is one thing, and then programs is a different thing. So people have to have clear that, you know, you might be eligible for a qualified health plan, but qualified health plans are offered by the different health plan carriers. So you might have 4 different health plans offering your silver plans, your bronze plans. So all of that is part of that decision making, right? And people need to understand that there's a difference of that. You'll fall into one of these programs, but these programs have different plans offering those programs.
Yes. Well said.
Okay, so sounds to me that obviously you need to know who your providers are, and based on that, it's going to help your selection of the plan.
It's helpful.
We're at,
well, what if you don't have a provider? What if you are 26 coming off of your, well, then you're going to want to look at what's financially sound for you and, you know, what your health needs are. So let's just say you're a young invincible and you just need to go to the doctor, right? Get your annual checkup. The only thing you want to find is a doctor near you that's convenient to you, whether it's convenient to home or convenient to work. Whatever's convenient, that's what you're going to look for. And again, you just go in with an assistant helping you and you look at those different plans. Okay, we got a plan. We got plan A. Perfect. Fits my financial needs. Silver plan. I get 3 visits and 3 sick visits. Yeah, I'm good. Where are the doctors near me? Well, we do a little search and we see where those doctors are that take that plan, and you know, you go. It's those lookup tools are so great and so helpful for you guys to be able to find things that work. But just keep in mind, if you don't have a PCP that you want to keep, if you don't care, you're just looking for the cheapest thing that works for you, go get it. And you can also look up and see what providers are available in your area.
And the other thing I wanted to mention is that, you know, once you are given the different options of the plans get little star rating in the marketplace.
Right.
So you also will be able to see that from 1 to 5 stars. So you'll see the different star ratings of each one of the plans. You know, that's another thing that can be considered and looked at.
Right.
and what is the rating based on?
All the services that they provide, and mostly as consumers, that, you know, feedback that they get,
Yeah.
that the state gets.
It's consumer feedback. Yeah.
Yeah. So let's talk a little bit about that added layer that you just put. So you were talking bronze, silver, gold, and I believe there are different pricing for each one of them. So do you know the difference between them? Like what will be, I mean, and Marcy, you just said, you know, if you want the cheapest thing, then if you want the cheapest thing, what do you go with? Like,
well, we can't really give you a number because, I mean, you can go in and you can see what the plans cost, right? But you may qualify for financial assistance because you're within the financial numbers. So you may get a bronze plan. You can get a bronze plan for, you know, $60. It just depends. All depends on what your financials are. That drives the cost of each plan. The only thing that is consistent is Medicaid is free. The essential plan is either free or $20. So that is the way that rolls. Open enrollment period for the metal plans, that's when we put in your information and that's when we find out what you qualify for. So Lil, you want to add?
Well, yeah, we cannot give you that number because it's going to be based on if your household is of 3 and 2 of you are working, but you're
Right.
working very minimum wage, then the system will generate this family is eligible for $400 of tax credit for their monthly premiums. So these are your options if you want a bronze, silver, or a platinum plan. But if you're a household of 1 and you are making almost the maximum, you might only get $50 of tax credit. It all depends
It
on
all depends.
and the income. So I can't really give you an answer straight up.
Right.
This is the price and that is.
Well, I think you're clarifying something for me here. So there could be 2 different people with the same plan, but they're paying different fees, correct? Based on their income.
It's all income driven.
Exactly. So let's
All
say
income.
you and I have bronze, both of us, but I'll pay one thing and you pay another thing based on our income.
If you both get a tax credit, yes, and you just happen to get different tax credit amounts, right, for your monthly payments.
Right.
So not everybody gets this tax credit.
No.
Okay,
Yeah.
so what do you do to get a tax credit?
Maybe keeping the mandate which was taken out. I don't know. Can't answer that one for you.
So you just have to
Okay.
go through the process and you'll see if you're qualified, what you're qualified for, if you get a tax credit, how much the tax credit will be. And you then move to what plan works for you based on what your financials say.
Mhm. Okay. Okay, so definitely it's no cookie cutter to these, like maybe that's where it gets so confusing, because it's like each person needs to go through the process to see what result you get and how much you're gonna end up paying and which plan is the one that fits you. And am
You
I
got it.
correct on that?
Yes,
You
and
got
then
it.
keep in mind what
Finally.
Marcy said. I don't know, Marcy, if you mentioned, I came in late to the meeting, but remember that vision and dental, right, is a separate little pocket.
Separate. Yes.
Oh yeah, I wrote it down here in my piece of paper. Like, can we talk a little bit more about that? Because you mentioned vision and dental, but I was wondering, you know, like some plans, even private plans, like you're paying for vision and dental, but it's only, you know, like 1 or 2 prophylactics a year and that's it. And if you have a broken mole or something, you're gonna have to pay out of pocket. So how does it work when you're in the marketplace?
Go, Lil.
Well, vision and dental are added for some plans. The plans will tell you once you're at the end of the application which plans offer vision and dental or have it included in their package. So they will all be slightly different. And then the essential plan also, right? You can purchase vision and dental if you're paying $20 for medical, right? Your essential plan, the $20 is talking about your medical coverage. Then that extra $15 for vision, maybe, I don't know, something similar for dental, that's extra that you will pay in addition to the $20.
Right.
The essential plan. So each plan will tell you what they include in that coverage, in that program. And if it's not offered, they will also tell you.
And you can purchase a separate plan. But you have to have the medical to get the dental and or vision.
Are there any services that are definitely not included in any of the plans? Like I know people that, for example, they have Medicaid and it's so hard to get specific medications or specific services. Like you can call 20 different places and they're like, no, we don't take your insurance. We don't take your insurance. We don't take your insurance. And you just keep hearing that. So.
Well, that's again, the provider lookup tool is terrific. If you find somebody that as a doctor is saying they don't take Medicaid, and they are in our plan, they're in our provider lookup tool, they do. Some people don't know it, some people don't want to, but they do. And if that is the case, you need to reach out to the New York State of Health and report the situation.
And what happens sometimes, sorry to jump in, sometimes
Yep, jump in.
it's a confusion between the doctor's office management or person that's picking up the calls, right? They hear the name of the plan, right? And they don't hear Medicaid, so they think they can take the plan, but then that plan comes with Medicaid. So sometimes that is the reason why maybe that office is
It gets mixed up.
Medicaid, but they happen to do because they take such plan that does happen to be with Medicaid. So consumers have to be careful in terms of how they ask the question to the doctor's office, and then be careful who's actually giving them an answer in the doctor's office. You know, they need.
So Liliana, if you were gonna do that call, how would you make that question? Let's say you're calling me and I'm the receptionist, and how would you?
Well, I would say, you know, I am
actually
applying for health insurance and I'm going to have Medicaid with this plan. Do you accept that coverage with that plan? So I would mention both. I would mention both. To be clear.
Medicaid, and then the how do you call that? The co-insurance?
The health plan.
Whatever the health plan and the name of the plan. So different health plans have their Medicaid name a little bit different than what their metal plan name is. And when you're going through the process of choosing, you will see that as you go through the process. So you'll just double check that your doctor is in Plan A, and Plan A is called the, we're making this up, Medicaid Advantage Plan A, right? You want to call your doctor and say, hi, I understand that you take this health insurance. I'm looking at getting into Medicaid Health Plan A, and I see that it says that you're in this plan. Can you just double check and make sure you're still accepting this? All right.
Okay.
And, you know, just a small story, personal story. I have a plan, and I think one option is Liberty and the other one is something else. And then once I called the specialist, they say, oh yeah, we take it. But then they say, oh no, we don't take that one. We take the one with the other category. So we have, as individuals, we have to be proactive in terms of making sure the person who's listening to us is understanding and we're providing the accurate information.
Yeah.
Okay. Yeah, that makes sense. That's exactly, I think, what our community needs to understand, because it's, you know, you just end up with the wrong plan, and now you cannot see your doctor and you cannot get your medication or your tests and stuff. So that's very important.
There's also every insurance company has a lookup tool too, where you can look up and make sure that your medications are covered. So that's another thing. If you've got folks that are on very specific medication, particularly for something like diabetes, juvenile diabetes in particular, you know, you can't switch around. You have the ability to look that up and see what plan takes that specific medication, because that's going to drive your choices as well, particularly for things like diabetes.
Is there a special insurance for HIV? For some reason, it's in my mind that if there is an organization. Yes, there is an organization that is under Visiting Nurse Services, and I can actually email you that information. There are two organizations that specifically work with HIV and other chronic diseases. They have a whole special program. So I can send that to you, and you can get that up onto either YouTube or your website and what have you. No problem. I just found out about them myself. Yeah, it's just like we don't have enough to worry about, we add one more.
Yeah, why not?
Yeah, right. Exactly. Now, we only have a few minutes left, but this is a last question. So open enrollment started on November, correct?
Correct.
So if you already, I don't know, did whatever you needed to do, and now after this webinar, you think, oh my God, I didn't make sure that my doctors are there. Can you still switch?
Yes.
Like, let's say you just switched because you were thinking, oh my God, this is cheaper, but I didn't realize maybe my doctor isn't there, and now I want to switch to another one because my doctor accepts that other one. Can I still switch again?
Yes. In the open enrollment
Okay.
period is when you can move around, for
Move
sure,
around
and switch. Now, couple
as many
things that
times
we
as you
should,
need.
yes. Now, one thing to be clear about, the 15th of the month is the cutoff date for the first of the following month. If you want your insurance to start on January 1st, you need to enroll by December 15th. If you're fine with it starting on February 1st, you can enroll on before January 15th. If you enroll after January 15th, the open enrollment period goes through January 31st, your plan will not start until March 1st when you hit after the 15th. So the 15th is the cutoff date for the following month, to start on the first of the following month.
So we have 12 days to make changes to come effective on January 1st.
Bingo. So everybody get Liliana's information and call her so you can get some help.
Liliana, I'll be the first one.
Well, we have a number of sisters that, you know, they already are aware of everything that we're doing in these meetings that Marcy is coordinating, and they are ready to go to help your team and your community.
For sure.
Okay.
And we have languages too. We have languages, so you don't have to worry about a language barrier. We have folks that speak all kinds of languages, so we can help out.
That is great. And, you know, in the beginning, Liliana, we all got to introduce ourselves, but you came a little later. So why don't you just introduce yourself and tell us a little bit about your agency? What is it that you do? Because it sounds like you're the, as Mercy said, bingo, you're the bingo girl.
Well, thank you again for the invitation. So I'm Senior Director of Health Operations here at the Hispanic Federation. We're a nonprofit umbrella organization here based out of New York headquarters, but we have multiple locations throughout the United States, in Orlando, Connecticut, and member agencies throughout the US. We work on different initiatives. One of the programs is this health program. We have been doing this work, just so you know, the Hispanic Federation has been partnering with the Department of Health since back in 1999 when we started Child Health Plus here in New York. And so I have not been at the Federation since then, but the work has been done since then, and we have continued to work with them during the Facilitated Enrollment Program, and now with the Affordable Care Act, with the New York State of Health Marketplace. And we have multiple partners throughout the city with this program. I oversee this program and the subcontractors that work with us. And we have multiple health initiatives at the Hispanic Federation, but we focus on the different avenues of programs that affect our communities, such as immigration programs, education programs, the environment. We have an office in Puerto Rico, and we also sort of do a lot of advocacy. We have staff that are based out of Washington, D.C. to do more of our federal advocacy. We have staff that is focused on the state level to do that advocacy work up in Albany. So in a nutshell, that is the Hispanic Federation, and Frankie Miranda is our current president at the Hispanic Federation.
That name sounds familiar, Frankie Miranda, for some reason.
Well, might be not related to Luis Miranda, who is the father of Lin-Manuel Miranda. But
Right.
Luis Miranda was the
no,
founder.
I wasn't thinking that way. Okay.
But actually, Luis Miranda was, just so you know, Luis Miranda was the founder of the Hispanic Federation, our first president.
Okay. Well, if he can get us tickets to Hamilton, that would be great.
You can watch it
Okay.
free.
Yeah, that's in Puerto Rico, hopefully. Okay, so we only have a few minutes left. So last chance for questions. If we don't have any questions coming, I just want to say thank you, Marcy and Liliana and Melissa, for helping to put this together. Thank you very much. Again, this is going to be on our YouTube page. So if you want to revisit the information, or if you want to share the information with people you think might be helpful to, just please do so. I'm going to be sharing the link hopefully later today if I don't get involved with something else. Sometimes that happens. I'll send a link to all of you. And with that, I just say goodbye and thank you very much. I feel like I know a little bit more how this really works. I was always very confused about it. So I feel a little bit more confident now. Thank you very much.
Terrific. You're very welcome.
you.
Thank you, everybody, for joining.
Thank you.
Liliana.
Thank you, everyone.
Okay.
Take care. Have a good
Bye,
day.
everybody.
Bye bye,
Have a good day.
everybody.